Welcome everyone to our What's Buzzing. We are so excited to be joined by Dr. Annan, who is the Executive Director of the Center for Mental Health Care and Resources. We just are so appreciative of his time today to share with us, especially during this point in the term, very early, about a variety of things from his office and his work that he does. So with that, I know we might have a lot of questions, so I do want to get started in a timely manner. But with that, thank you, Dr. Annan, for joining us today. I'll hand it over to you.
All right, thank you, Sharon. I'm very happy to be here and joining you all, parents, today to talk about a topic that is very near and dear to me and the work that I do. And I'm always looking for opportunities to talk to students, faculty, staff, parents, alumni, anyone who is interested in supporting the mental health of students on campus. And so I jumped at this opportunity to be able to meet with you all today. As Sharon said, my name is Vidal Annan, and I'm the Senior Director in the Center for Mental Health Care and Resources here at Georgia Tech. I'm in my third year at Georgia Tech and, uh, enjoying the experience and enjoying the work and the interactions with your students. And it's been a great opportunity to uh, to support them in their path to completing their degrees and moving on with their professional and personal lives. Um, I think in thinking about the opportunity to speak with you all today, I felt like there were some things that I wanted to share and to provide some details on, but I'm absolutely available as well to answer any specific questions that you all might have around mental health on campus. One of the things that I like to say is that in terms of Georgia Tech as an institution, there is definitely a commitment to making sure that students are not only receiving the best mental health care that they can, but that they are living, learning, and connecting in an environment that is also focused on and supportive of mental health. And so the mission of our office is not just to provide mental health services to students who might need those types of services, but also to support faculty, staff, and other folks on campus on creating an environment where students can maintain their mental health, strengthen their mental health, and grow their mental health skills and knowledge as well. Um, the main core of our work is that we are interventionists. So everyone on my team here at the Center for Mental Health, we're all licensed providers of mental health services. We have psychologists, we have licensed clinical social workers, and we have licensed professional counselors as well. And so we all maintain our degrees and make sure that we are bringing students the best care that we can. We are the interventionists. We provide the range of counseling services, which I will talk about in a little bit more detail. We do assessments, we do testing, we do all of those things that are, I guess you could consider mental health interventions that students could benefit from. And that's our main focus. Um, the other things that we do, again, are focused on supporting the campus overall. And so we have a pretty big outreach and programs arm where we are doing tablings on campus. We do presentations to students on topics related to mental health, letting them know where our office is, what services we provide, making them familiar with mental health, reducing stigma around mental health, and increasing access. Those are all things that we do through our outreach and program services. And so it keeps us busy, but I think we're doing good work in supporting the students as they focus on being strong and dedicated students and, persisting to their graduation. I do have one slide that I have on the screen that I wanted to take you all through because I think it's important for you all to know how mental health services are coordinated and organized on campus. like I said, there's a real commitment to mental health on campus. And so there are lots of different services and offices on campus that either provide direct mental health services or provide services that support the mental health of students. And so one of the things that the Center for Mental Health Care and Resources, my office is responsible for, is for organizing all of those services in a way that a student can go through the process in the simplest possible way. We don't want them to be confused about which office to call and which service to sign up for when they are having difficulties or they're in a crisis or anything like that. We want it to be as simple as possible. And I think by sharing that information with you all, you can then have some sense of how it's organized and then be able to provide the support to your student if if they ever need it. Okay. So I'm going to go through these slides, and if anybody has any questions, they can always feel free to stop me as we go. The best way to contact our office if a student has any concerns around their mental health is by calling us or by walking in. We are located in the Smith Gall building on the second floor. We are right next to the Student Center. And our office is very accessible for students who want to walk in. And between 8 and 5 every day, our door is literally open, and students can walk in and speak to our front desk to request services. If they don't want to walk in, they can also call, and our front desk team will pick up the phones right away and engage them. Once the student walks in, they will be met with or they will speak with one of our front desk or receptionist teams who are responsible for receiving them, welcoming them, making them feel comfortable, and then helping them to schedule their first appointment. And the first appointment will always be with one of our case managers. We have a team of 7 case managers here in our office, and the case managers are responsible for conducting the initial assessment, where we get, the background information, the presenting problem, any information that is pertinent to the functioning of the student. We try to get that information in that initial assessment. At this point, a student who walks into our office could be sitting and speaking with a case manager in as short as 2.5 days. And even that time, that 2.5 days is not just a matter of when appointments are available, because we could have appointments available as early as the next day, but we also try to be flexible and meet the needs of the student and what their schedule is. But on average, in the last semester, we were able to see students in about 2.5 days. If the student is in crisis or needs to be seen right away, they can be seen between 15 and 30 minutes for an assessment. So going back to our service flow model here, once they meet with the case manager and that initial assessment is completed, the case manager will generate what is known as a care plan. And I'm sorry if the contrast is not great on the screen. But the care plan is a document that the case manager comes up with that looks at all the possible services, uh, clinical services on campus or non-clinical services on campus that would be of benefit to that student. And the care plan can recommend many different types of services depending on the needs of the student. For example, the care plan could indicate that the student would benefit from meeting one of our counselors. And we have a team of about maybe 10 to 12 counselors who can meet with a student to provide individual, group, or even couples counseling. Couples counseling is unique in our office in the sense that only one of the couple needs to be a Georgia Tech student. The other person can be, the partner can be from anywhere, and we will be able to meet with them as a couple. And so that's a unique service that we try to provide to students, undergraduates and graduates. So that's one option that the care plan might recommend. Sometimes what the student would benefit from is not a meeting with a counselor, but with another mental health or wellness provider on campus. If there's a medical aspect and the student may benefit from medication, we do have a psychiatry office on campus as well, where we have about 5 or 6 psychiatrists where the student can be connected with to discuss any kind of medication informed treatment, or they could receive a psychiatric evaluation as well. We also have a wellness coaching on campus. And wellness coaching is less about focusing on the psychological aspects of the concerns of the student, but more so on thinking about what kinds of lifestyle changes might benefit the student in terms of them feeling better. And if there is any kind of uh, sexual assault components to what is going on. We do have voice advocates, which is these are advocates on campus who can provide support to students who might be dealing with that specific type of concern. Um, Sometimes a student will present to our office with concerns around mental health, but the solution may not necessarily be a mental health intervention. Sometimes students might be anxious about their academics and maybe connecting them with the dean of students office to get some clarification about whether they can drop a class, or they can add a class, or they can, take a break, or they need a note for their professor, things like that. We would connect students with the dean of students office. If they need some academic support, if they need some advisement, if they need some tutoring, we can also connect students to those non-mental health types of services. And then, we also have the STAR program on campus, which can provide students with information and support around very basic needs types of concerns around finances, housing, food insecurity, that kind of thing. Sometimes the what would benefit the student might be a type of intervention that may not be available directly on our campus. I think we have a lot of resources available, but again, we don't do everything. And so sometimes by connecting students with services off campus, that could be the benefit for them. And so they may be connected with a specialty practice off campus. So for example, if the student has concerns around an eating disorder or a particular type of substance abuse concern, those might require very specialized care that we may not be able to provide on campus. So we make sure to connect them in the community. They might need a particular type of treatment facility. Now, another service that you see listed here, it's called UWIL. And UWIL is a counseling platform that is available through the state of Georgia, where students can get 3 free counseling sessions on their own. They don't need to even come through our office. And that is of no charge. So long as they're a Georgia Tech student, they will get those 3 counseling services for free. And once they are done with those 3 counseling services, if they feel like they needed extended care, they could always connect with our office to get additional support. So as you can see here, there are a lot of different ways that we try to get students what they need. If the student is feeling that they need mental health care, they can come in, meet with us. We do the assessment, we speak with them, we come up with a plan, and then we help them to be connected to the most appropriate resource to help them to be able to start to feel better, to get a better sense of what their needs are, so that they can get back on track with their academics and the other reasons that they are in college, which is to get that degree and and to move on with their careers. So I hope this is helpful to kind of see this laid out. If there are any questions or anything like that, I'll be more than happy to address those now. Um, and I can also talk in detail about some of the programs that we have, but I'll hold off and see if there are any questions first, and then I can go from there.
Yeah, so it looks like we have one question. I think they're just asking the service hour days Monday to Friday. Could you reiterate those?
Yes, absolutely. Yes. So we are available um, in multiple ways, basically 24/7, 365. So what that means is that during business hours, we are open and a student can actually come into our office between 8 and 5 p.m. every day. On Thursdays, we have extended hours until 7 p.m., and those last between 5 and 7 are for scheduled appointments. We do specialized groups and things like that for students during those hours. Um, but then outside of the 8 to 5 business hours, so maybe we're talking about from 5 p.m. to 8 a.m., we always have a clinician who is on call, and then we also have a an arrangement with a provider who receives calls for students who might have questions or might have some significant concerns. If a student was not feeling well at 2 a.m. and needed to call someone, they can call our main number, and they can select the option to speak with the after hours counselor, and there will be someone available to speak with that student. And so this occurs in the summertime, over breaks. So whatever the issue is, whatever the concern is, we're basically available 24/7. But if the student actually wants to speak with one of us in our office, 8 to 5 p.m. On weekdays is when they can do so.
Perfect. Thank you. And then kind of going with that, can you
Mhm.
tell us if a phone number is adequate for students to call? The question is, what is the phone number?
Yes. And the phone number that a student can reach us is 404-894-2575. So
I'm
that's
going to put that in the chat.
404.
Four
Yes.
four four 894 2575.
Yes.
Perfect. I'm going to put
And
that.
once they call that number, the phone will be picked up. If it's during business hours, it will be picked up by someone in our office, one of our front desk team who can then answer any questions or help the student to make an appointment. And it's the same number. If the same number is called after hours, it'll connect you with our after hours counseling service.
Perfect. We do have a few more questions.
Mhm.
Let's see. Do you offer ongoing therapist counseling appointments, or do you only handle crisis management in between their private practice counselors?
Yes, that's a great question. So we do provide ongoing services. So it's not just a matter of just seeing them one time for a crisis. We can see them for extended periods over the course of a semester. And we do have a short-term modeling, a short-term counseling model. So which means that we couldn't see a student for a year or anything like that, but we do see them for maybe 10 to 12 sessions, maybe up to a semester long, and we do assessments along the way to see if students are showing improvement and getting better. On average, students will see us about our data from last semester showed that students will attend sessions about maybe about 6 or 7 sessions usually, and usually they'll report some improvements. If they do need to be seen longer, we can either see them for longer if we have the capacity, or we will connect them with a longer term clinician, either privately or someone in the community. So we help them to be able to make those connections as well.
Thank you.
Mhm.
If the services are on-campus support, are there additional costs?
Mhm. So there's absolutely no cost to any of the services that we provide on campus. So a student will never have to pay for anything, for counseling, for to be part of an outreach event or program or anything like that. There's no cost to students at all.
Perfect. How would a student presenting with anxiety typically be helped?
Yeah. So I think if a student is experiencing anxiety, the first step would be to contact us. So again, they can call or they can walk in, and all they have to do is walk up to the front desk and say, "Hey, is it possible for me to speak with someone around my mental health?" They don't even need to get into the details because that is sufficient. The next question will probably be from our front desk. Do you feel like you need to see someone in this moment? Are you experiencing a crisis, or would you like to make an appointment? That would be the next question. And if they feel like they're in crisis or having a difficult time in the moment, they could see someone right away and they could be seen between 15 and 30 minutes. But if they wanted to schedule an appointment for another day to have an initial appointment, then they can make that appointment. They could schedule that time. And then when they come back to the office, they can meet with the case manager to do the initial assessment.
Perfect. Can you prescribe if needed?
hmm Yes, whenever there is need for medication intervention or prescription, we will connect them with the psychiatry office on campus, and we work very closely with them. But they are responsible for any types of medication-related issues around mental health.
Okay. And for the 3 free You Will sessions, do students reach out to a central phone number to schedule those directly?
hmm Yes. So YouWill is a digital online platform, And so a student just needs to go to uwill.com. And once they have, and they will be asked to set up a profile. And so long as they use their Georgia Tech email, the UWill platform will recognize that they are a student and it will direct them to the service that is free. So they will not have to pay for anything. And then they can go ahead and they can select the times that they want to meet, the type of clinician, what their presenting problem is, and then they will be connected to a UWill counselor who can then meet with them for those 3 sessions. And
Perfect.
and this and they can a student can access UWill completely separately from our office. So they don't, there are a lot of students who we have on campus who may not feel fully ready to actually call us or walk into our office. They just may not be at that level. They, for reasons of stigma or just they might be reserved or whatever it might be. But even for those students, we want them to still have access. And so in the privacy of their own room, they can go online, they can set up their UWill account, and they can still receive the service even without having to connect with our office.
Great. Another question. How do the
Mhm.
services work with out-of-state students that go home for the summer breaks? My daughter tried to get help in the spring around final exams and was told to come back in the fall to address her anxiety and was encouraged not to receive help at home during the summer. This was concerning and she felt dismissed when she was in an anxious time.
Mhm. Yeah, so if a student lives out of state, um, we all have Georgia licenses, so we have to see we can only see students in state. But I don't think that we would recommend to a student that they don't receive services when they go home. In fact, we would encourage a student to receive services, whether it's over the summer break or over the winter break, if they want to arrange that. One of the other ways that we have been filling that gap when students are not on campus is that they can always use UWill as well, because UWill is not tied to Georgia. Yeah, a student could be in Maryland or New York or California and still be able to use their UWill so long as they have that Georgia Tech email. And so, I'm sorry to hear about the experience that this particular parent and student experience, but we would not recommend to a student that they should not receive services while on break. We would actually, part of our job is to help the student to be able to identify resources while they're away from campus.
Right. Um, and if that parent would like to follow up, would that be could we drop an email in here for them to follow up?
Yes, absolutely. Yes, I would be very happy to speak with the parent.
Okay.
Um, they can email me and we can discuss maybe what some concerns are. Because again, we want to make sure that students are receiving their mental health, whether they're on campus or not.
Okay.
Yeah.
Yes, we'll be sure to drop the email in the chat
Mhm.
for everyone.
Mhm.
All right. We have a few more questions. And Vidal, I can drop that. Just do you want it to be
Oh,
the
actually, yes. I can go right to the chat myself right now and put
okay,
that
perfect.
email in
Just
there.
make sure it's clicked to everyone instead of host and panelists when you
Ah, yes. Thank you for
yeah.
recognizing that, Sharon.
It gets me almost every time, so that's
Yes.
fine. Just gonna pause 1 second, guys, to make sure that you'll have this email in case you need it, and then we'll continue with the questions.
There it is.
Perfect. Thank you. All right. So moving back to questions, I'm kind of toggling between Q&A and chat. In the future, guys, if y'all will put the questions in the Q&A feature, that'll be really helpful. Sorry, I forgot to mention that as we started. Okay, let's see. What is the office's level of experience with late diagnosis of high functioning autism?
Mhm. Yes, we work with quite a few students who are on the autism spectrum. And I would say that any student who is on the spectrum and feels like they could benefit from receiving counseling or other types of support on campus should reach out to us. We have professionals here who have worked with students on the autism spectrum in a number of different ways. and also connecting them with other types of resources on campus, including the Office of Disability Services where it's appropriate. Psychiatry has a group, an ongoing group, a support group for students who are on the autism spectrum. So there are a lot of resources that we could be able to connect the student to.
Okay, great.
Mhm.
Um, do you do assessments for ADHD and provide related treatment?
Yes, we do have an ADHD screening service that we provide, and we can provide counseling services for students who are diagnosed with ADHD. In terms of medication, psychiatry does not provide stimulant medication treatment, but that's a separate office, and that's something that they have that they sort of arranged that they don't provide, but they can provide information for students to be able to receive that type of prescription from an outside provider, for example, if necessary.
Got it. And then we have a question about UWill. It says,
Mhm.
is UWill online only? In other words, the student is meeting with someone online via computer and not in person.
Yes, yes, UWill is a fully digital platform. If the student is receiving services through our office, they can either meet in person or virtually, and we provide both services for students.
And I think that kind of answers this next question. Will every student get an in-person counseling session or will they be sent to UWill?
Yes, no, not every students. So you will is usually we usually will reserve that for students who might have a concern that based on our assessment, they could benefit from maybe 2 or 3 sessions. Not every student needs to be seen for a semester. And so usually we will encourage students to try you will that way. Because then, their needs might be low acuity based on our assessment. Now, if the student completes the 3 sessions and they feel like they still could benefit from more support, then they could always still reach out to us and we would continue to work with them. And also, you will can is also a service for students who would not like to interact with us, would prefer to do it on their own and figure out their mental health on their own. That's something that they can do completely without having to go through our office. Mhm.
Perfect. Um, this question says, my student needs a refill prescription for her antidepressant, but can't get home to see her GP before she runs out of pills. Can the campus psychiatrist write a script for her? I can have the GP's office send her records if you tell me where to have them sent. Thank you.
Yes. So the process for being connected with psychiatry usually involves the student initially meeting with one of our case managers. We have a lot of services available on campus. Sometimes students are not fully aware about other types of supports that they could benefit from. And so they may just be focusing on getting their prescription refilled, but we may have some other information that might be beneficial to them. So we like to have that conversation ahead of time and then connect them with psychiatry where they could get their prescription filled. But they would have to go through our office and not just contact psychiatry directly.
Got it. All
Mhm.
right. Can a student make an appointment to see the psychiatrist to get prescription refill for an antidepressant? Should they call the office to make the appointment? I
Yes,
think,
they would call our office. Again, it's similar to the previous question.
yeah.
They would call our office, and then the student is encouraged to have the assessment with the case manager. And then as part of the care plan will be a referral to psychiatry.
Okay.
Mhm.
And then let's see, do any of your mental health services provided cost money? My student is out of state and does not have insurance that would cover these mental health services.
Mhm. While the student is in Georgia, if they are on the Atlanta campus, if they're in Atlanta, they do not have to pay for the service, even if their home address is in another state. So long as they are in Georgia, they can receive the services for free. And if they happen to go back to their state, let's say over the summer, and they still needed some support, they could access UWill if they want to, or they can talk to us and we can help to identify resources in their state, in their town, in their community, and help them to connect with those services that they can use, over the summer or over the winter break or whenever.
Okay. So kind of someone clarifying their question from
Mhm,
earlier.
mhm,
I want to know if students can meet with someone in person or will someone be automatically put into UWill? The latter is my experience, and I was disappointed that a student can't get in-person help if they aren't severe. I was hoping office had expanded to handle more students.
mhm. Yeah. So, yeah, the issue of meeting with a student, the issue of a student meeting with a counselor in our office is generally not an issue of availability. It's an issue of which treatment is likely to be the most effective. We at this point we have enough members of our team that we can absorb. We meet with all students. We have no wait list at this point. Every student again is seen within 2.5 days. So UWIL is recommended to a student if that is the most, in our clinical judgment, it will be the most effective intervention for them. If they need to be seen in person, we always have someone who can see them in person. Sometimes students will want a particular type of intervention just based on their particular thinking, but we try to work with them to understand that, it really comes down to what would be the most effective from a clinical perspective, and not just a personal preference. We do take into account personal preference as much as possible to make sure that students are connected with the service that they're most likely to continue with. Mhm.
Great. Okay, thank you.
Mhm.
And then sort of a comment question from Heather. This system did not work for us last year. We moved basically all care away from Georgia Tech. Is there a way to start the process again? Because it would be much easier to do on campus for our student.
hmm Yes, I would say in that situation, not knowing the details of it, I
Mhm.
would encourage the parent to talk to their students to come in and make an appointment with us, and we can review the case. We probably will still have the records. I don't know if the student was referred off, into the community because of the specifics of their needs, or I'm not sure, or did the family decide? I'm not 100% sure about that, but we
Mhm.
can absolutely review the case and we can see any student. If a student has been here before, they can always come back, and we can always meet with them to determine where they are at that particular point in time, what would be most effective for them, and then help them to be able to be connected to that service.
Great. And I don't think we've answered this,
Mm-hmm.
but let's just double check it. Or I think we may have answered it in part, but just want to be super sure. When a student is already taking medication prescribed by an out-of-state psychiatrist, what is the procedure for getting their medication in Georgia?
Yes. So if if the student feels that they would need to have their prescription refilled in Georgia while they're here, they can be connected to psychiatry. And so I would say a student who's in that situation should reach out to us and speak to us and give us the details of their situation. It also depends on when in the semester. So, for example, if a student comes to us in May, and they're going to be going back to their home state on May 15th at the end of the semester, that would be a very different plan than if the student reached out to us at the beginning of the semester, where they would be in Georgia for 4 months. So we take all of that into account in determining what would be the best recommendation.
That's great. Heather did provide a little bit more context for the previous question. She said the resource referrals were all dead ends. Nearly everything provided was out of date. So,
Mm,
so it sounds like Heather, it sounds like your student can come back on campus, make an appointment, and get started all over again on campus when ready.
yes, yes, and a lot of times, um, and I want to kind of say is I don't know if this is specifically the student and parents. If this is the sort of the details of their situation. But a lot of times in working with students, they are taking this step to reach out to services on their own for the first time. If they're 18, the arrangement that we have is with the student, not with the parent,
Mhm.
right? Because they are of age and they can consent to treatment themselves. And so the work that we do is directly with that student, and so, we try to follow up as best as we can. And so it's a balance of us being able to provide them with what they need, but also respecting that they are young adults who can make decisions about their own care in the way that benefits them. And so a lot of times when we give a student referrals, unless the student gets back to us and says, these services did not work out, a lot of times we usually will follow up once, and maybe twice. But if the student doesn't reply or they don't tell us what happened with the referrals, we usually can't tell what's going on. And so I always encourage parents that they can talk to their students to always circle back with us because, our goal is to get you connected somewhere. It's not, it's not satisfactory for us to give a referral and the student call that referral and that referral is a dead end. In those situations, the student should really, get back in touch with us and let us know, hey, listen, that particular practice is no longer open or they're not accepting clients at this time or something. And our job is to continue to help them to be able to connect with someone.
Yeah, always anchor back to us if something's going awry. Yeah.
Yes.
Um, One more question in the Q&A just popped up. We live
Mhm.
in Georgia, and when my daughter called the office this summer, she was told by the office that she couldn't make an appointment in the summer because she wasn't enrolled in summer classes. How does that work?
Yes, absolutely. And that can happen. So the services that we provide are for students who are considered enrolled, right? Or considered students. And so that can be very tricky at different points for different students because if it's during a regular semester and the student is enrolled, we can see them. In the summertime, it can be very tricky because if a student is not enrolled in the summer and they have not enrolled for the upcoming fall, they're not technically considered a student.
Mm,
So a lot of times what we will say to students who might come to see us is that if it's in the summertime and they're not taking a summer class, once they enroll in the upcoming fall,
mm,
they are now considered an enrolled student again, and we can see them in the summer.
mm.
But they have to be enrolled for the upcoming fall or the upcoming semester.
To show they're a
Otherwise,
continuing student. Yeah.
exactly. Then they are considered a continuing student, and then we can see them. But if they are not taking classes in the summer and they are not enrolled for the fall, then again, Georgia Tech does not consider them continuing students at that point, and so we cannot provide services to that particular student. Yeah.
Okay. And the parent has a quick follow-up.
Yes.
She was enrolled for the fall and was told she needed to wait until classes started.
Yeah, so again, not knowing the details why
Right.
that was said, if they were enrolled in the fall, then they are an ongoing student and we can provide support. It may have been, maybe the reason might have been something clinical. I'm not sure. And but I would say that, if the student did not get connected to a service or did not receive services on campus, again, they can always come back in and, our job is to figure out what didn't work and to help them to be able to get connected somehow.
Yeah, sometimes it's hard to know all the details while we're in a webinar, but Lisa, thanks for asking all these good questions. And of course, if you have additional follow-ups, you've got Dr. Annan's email if you scroll back in the chat, just if needed.
Mhm.
And we've got a parent, she said, my apologies, but I joined late, so not sure if this was discussed or not. Is there a group or class that helps students with ADHD and procrastination issues?
Mhm. So we do have groups that we have through the Center for Mental Health Care and Resources that are focused on students who have those types of concerns. We also have individual counseling services for students who have those. There's not a class as such, because any kind of class or support group is not considered clinical. And so most of our services are clinical. So we would have groups and individual services within our center. But once it gets to campus in general, there may not be anything available to support students who have issues around procrastination or may have ADHD types of symptoms. So I would say that student should reach out and connect with us. And then once we do the assessment, we can make a determination if a group would be better for them, if an individual would be better for them, if they should be connected with psychiatry or, whatever it is. And I also wanted to add, Sharon, too, that one of the reasons why I wanted to give this service flow diagram was just to also highlight to parents that just because a student comes into our office with a focus on something mental health does not necessarily mean that the best outcome is for them to be in individual counseling. That is not always the best outcome. We have had many students who will come in and then at high levels of anxiety because they have a concern about a class. And in the initial assessment with the case manager, they are informed, oh, you can go to the dean's office and drop the class. And immediately the anxiety evaporates because they don't need ongoing counseling for that. They just need to go to the dean's office and drop the class and they feel better. And then they can go on with their lives. And so there are so many different types of interventions that could be beneficial. And it's not necessarily always the case that it is counseling. There are many other things that it could be, even if the student at the time that they come to our office feels that their concern is primarily mental health. It doesn't necessarily mean that the most effective intervention is counseling or clinical in that sense.
Yeah. It's not like you're always going to go to the hospital and then immediately get surgery. There's going to be some
Yes.
triage in there to figure out what's exactly needed. Sure.
Exactly. Sometimes a lifestyle change might be beneficial. Sometimes a referral to some other type of service might be beneficial. So it's really based on the assessment, and we try to do the assessments as thoroughly as we can to make the best recommendations for the student.
Perfect. Any more questions, you all? These were really great questions. And of course, we have this recorded. We will have Dr. Annan's slide available as well alongside the recording for those of you who may have joined a little bit later. So you won't miss any of the information. But any other questions before we wrap? I think we have one. Oh, nope, just a thanks. You're very welcome. You're very welcome. We're glad to do it. And we felt very passionate about offering this topic earlier rather than later in the semester. Um, and doing a Q&A, we thought about, for those of you who are new families to tech, we have our Welcome Rec series but those are recorded and it's just a recorded conversation with no live interaction. And so we really wanted to provide this, like I said, sooner rather than later and get this audience participation because sometimes we can't anticipate what your questions might be. And that really can drive, how we serve you better and how we serve your students better. So we just are really appreciative of you all as well. So,
Yes. And
um,
Sharon, if I could add also just, I think I wanted to share that we are very much open to parents reaching out to us
Mhm.
with questions, right? We part of our job is we know that in order to support the mental health of a student, it takes a community, it takes a partnership. And
Mhm.
so for parents reaching out with questions about services and what's available on campus, we're very happy to provide that information. Um, you know, where it gets a little bit trickier is when parents are asking specific questions about their child's care. And that is where we want to honor the confidentiality and the independence and the autonomy of that young person who has taken it upon themselves to reach out for services and to follow through on those services. And in those situations, we're not able to provide information to the parents, but we always encourage the parents to speak with their student. And we can always receive information from
Mhm.
parents, but we just won't be able to acknowledge that their student is seeing us or be able to share any information because of confidentiality. But if you have any general questions about mental health on campus, please don't hesitate to reach out to us. We are always very happy to answer those questions and point you in the right direction.
Yes, absolutely. It takes a team, and we are more than happy to continue highlighting all the good resources that Georgia Tech has, especially in the space of mental health and Dr. Annan's team, such a great team. So, and thank you, Sandra. Yes, we did want to allow for a lot of time for good questions because we know that um, this warrants a lot of questions sometimes. So we're happy to do that. All right. Well, with that, thank you, Dr. Annan. Thank you, families, for taking the time to join us live. And again, this will be recorded and put back on the Hive here in the post where you saw it advertised. Hopefully, by the end of this week, we actually have a lot of online engagement for y'all this week. So we're hoping to have it all wrapped up by close of business on Friday with everything. But thank you all so much. Have a great day and go Jackets.
Go Jackets.